Bismillahirrahmanirrahim. Quote of the day: Life is like a piano. The white key represents happiness and the black shows sadness. But as you go through life's journey, remember that the black key also creates music. Assalamu alaikum. Today, the topic of my presentation is primary healthcare under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is about definition of primary healthcare, selective primary healthcare, what's the philosophy and strategy of primary healthcare, key elements, principle and components of primary healthcare, constraints and structure of primary healthcare, especially in Pakistan, referral services, recent advances, and at the end, there is MCQ session. By the end of this presentation, participants will be able to describe about what is primary healthcare and selective primary healthcare principle, component and its structure, referral services and MCQs. Health for All. In 1977, World Health Assembly launched a movement, Health for All, by the year 2000. And the mission statement is the attainment by all people of the world by a particular date of a level of health that will permit them to lead a socially and economically productive life. And they set the three guiding targets: life expectancy at birth above 60 years, infant mortality rate below 50 per thousand live birth, and under 5 mortality rate below 70 per thousand live birth. Concept of primary healthcare. 1977, the Director General of WHO called for a new strategy. The health of the world had not improved. So the International Conference on Primary Healthcare was convened in Alma-Ata, Kazakhstan in 1978. And in this conference attended by all member nations of the WHO and UNICEF, and become a core concept of WHO goals of health for all. What is the definition of primary healthcare? Primary healthcare is essential healthcare made universally accessible to individuals and families in the community by means of acceptable to them through their full participation and at a cost that the community and country can afford. Ottawa Charter. 1986, Ottawa, Canada intended as a plan for action to achieve health for all by the year 2000 and beyond. Established Canada as a leader in health promotion, and they outlined 5 areas that defines health promotion: build health public policy, create supportive environment, strengthen community action, develop personal skills, and reorient health services. In Ottawa Charter, they define prerequisites for health, and that is peace, shelter, education, food, income, stable ecosystem, sustainable resources, justice, and equity. Now, what is selective primary healthcare? Selective primary healthcare framework advocated more economically feasible approach to primary healthcare by only targeting specific area of health and choosing the most effective treatment plan in terms of cost and effectiveness. UNICEF proposed a selective approach with emphasis on and maternal child health according to GOBI and Triple F, which indicates growth monitoring, oral rehydration, breastfeeding, and immunization. And Triple F stands for female education, family spacing, and food supplementation. Philosophy of primary healthcare. Health is related to the availability and distribution of resources, health resources, and socio-economic resources. Therefore, primary healthcare is concerned with equity, which means that available health and social resources are distributed justly with due consideration for those in greatest needs. Primary healthcare strategy. The need for change in healthcare system means allocation of health resources will be carried out according to needs, intersectoral action for health, individual and collective responsibility for health. There are 5 key elements of primary healthcare. And the ultimate goal of primary healthcare is the attainment of better health services for all. It is for this reason that the WHO has identified 5 key elements to achieving this goal. And these 5 key elements are reducing exclusion and social disparities in health, organizing health services around people's need and expectation, integration health into all sectors, pursuing collaborative models of policy dialogue, and increasing stakeholder participation. Now comes the principle that guide primary healthcare. A series of basic principles identified in Alma Ata Declaration that should be formulated in national policies in order to launch and sustain primary healthcare as a part of comprehensive health system and in coordination with other sectors. Equitable distribution of healthcare. According to this principle, primary care and other services to meet the main health problems in a community must be provided equally to all individuals, irrespective of their gender, age, caste, color, urban and rural location, and social class. And the second principle is community participation. In order to make the fullest use of local, national, and other available resources, community participation was considered sustainable due to its grassroots nature and emphasis on self-sufficiency as opposed to targeted approach dependent on international development assistance. And the third principle is health human resource development. Comprehensive healthcare relies on an adequate number and distribution of trained physicians, nurses, allied health profession, community health worker, and other working as a health team and supported at the local and referral level. And the fourth principle is use of appropriate technology. Medical technology should be provided that is accessible, affordable, feasible, and culturally acceptable to the community. And the fifth principle is multi-sectoral in approach. And in multi-sectoral approach, they discuss that different sectors involved in to get the primary health care possible. Recognition that health cannot be improved by intervention within just the formal health sector. The sectors include at least agriculture, education department, communication, housing, public work, and adequate supply of safe water and basic sanitation, rural development, industry, and community organization like panchayats or local government and voluntary organization. Now comes the components of primary health care. Education about common health problem and what can be done to prevent and control them. Maternal and child health care, including family planning, promotion of proper nutrition and food supply, immunization against major infectious diseases, adequate supply of safe water and basic sanitation, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries, basic laboratory service and provision of essential drug, training of health guides, health worker, and health assistant. Referral service is one of the strong component of primary health care. Mental health, physical handicap, health and social care of elder people. There are some basic requirement of primary health care, and there is 8 A's and 3 C's: appropriateness, availability, adequacy, accessibility, acceptability, affordability, accessibility, accountability. And in 3 C's, there is completeness, comprehensive, and there is a continuity. Primary healthcare is an approach that mainly focus on a person, not disease. Consider all determinants of health, integrates care when there is more than one problem, use resources to narrow differences, forms the basis for other level of health system, address more important problem in the community by providing preventive, curative and rehabilitative services, organization deployment of resources aiming at promoting and maintaining health. Basically, primary healthcare provide two type of services, curative services and preventive services. And in preventive services, there are general services and care of vulnerable groups like maternal and child care, school-going children, elderly population, and occupational health services. And in general services, we can provide health education, environment monitoring, prevent and control of endemic and epidemic diseases, and health office services. And in curative services, all type of OPDs, laboratory services, first aid treatment. There are several advantages of primary healthcare: better access because services are provided in the community, cost effective than hospital care, improved communication services seeker and service provider, adequate primary healthcare provision, outweigh the need of a more specialized healthcare. There are some constraints in primary healthcare like political climate, disregard of human rights, political commitment, lack of appreciation of multi-phased approach. The structure of healthcare delivery system. Healthcare services are provided to cater different diseases of varying intensity, hence the level of healthcare needed varies. The healthcare delivery can be recognized into three levels: primary healthcare, secondary healthcare, and tertiary healthcare. Primary healthcare, it is the level of contact of individual, families, and the community with the healthcare system, bringing healthcare as close as possible to where people live and work, and constitute the first element of continuing healthcare process. The first level of contact between the individual and health system, essential healthcare is provided. Majority of prevailing health problem can be satisfactorily managed closest to people, provided by primary health centers. Alma Ata Declaration recommended that primary health care should evolve from economic, socio-cultural, and political condition of the country and its community. Primary health care is for the people and by the people, address main health problem in the community, and it must be provide promotive, preventive, curative, and rehabilitative services, include health education, food and nutrition, adequate water supply, basic sanitation, maternal and child health, family planning, immunization, prevention of local endemic disease, treatment of common diseases, and provision of essential drugs. It must be intersectoral, promote maximum community self-reliance and participation, be sustainable and integrated with referral system, rely on all cadres of health worker. Secondary healthcare, it is more complex problem are dealing here, comprises curative services provided by Tehsil headquarters and district headquarters hospital, and in tertiary healthcare offer super specialist care provided by regional and central level institution, provide training program. Primary healthcare in Pakistan, it consists of basic health unit which serve 5,000 to 10,000 population, and the services which are provided in PHUs are maternal and child health services, child care, immunization, diarrheal disease control, malarial control, child spacing, mental health, and school health services. Outreach services will be provided primarily by maternal and child health through training of birth attendants, 5 to 10 BHUs, basic health units, will be linked to a rural health center. This is the organogram of basic health unit, in which the main governing body is the medical officer, and it deals with the facility services and outreach services. Rural health center. In rural health center, there are 25 patient bed, a laboratory, X-ray, provision of a minor surgeries, and a dentist. RHC is linked to a SEHAT, which is then linked to a district health hospital. The whole system of BHUs, RHCs, THQs, and finally DHQs is designated as Integrated Rural Health Complex. This is the structure of rural health center, and the main body is senior MO, and then medical officers, charge nurses, lab technicians, senior clerk, junior clerk, midwives, drivers, sanitary inspectors. Now, what is primary healthcare planning? Key concept in primary healthcare planning is equity. Everyone should be entitled for healthcare. His needs should be taken into consideration. Together, both the statement means that everyone should be provided care as per their need, as everyone's needs are not equal. Providing services to people according to their need is important. However, without efficiency and effectiveness, they fail to have an impact. Effectiveness. Each primary health program activity such as EPI should have its impact measured through a various indicators. Effectiveness lacking in equity and efficiency would means loss of desired force of effectiveness. Efficiency. Whenever primary health care programs are undertaken, they should be low cost and consistent with favorable effect. To have efficiency without equity and effectiveness means inaccessibility to large section of population to obtain desired result. Now comes the referral system. It is a process in which a health worker at a one level of the health system, having insufficient resources to manage a clinical condition, seeks the assistance of a better or differently resources facilities at the same or higher level to assisting or take over the management. Why there is a need of referral system? To seek expert opinion regarding the client, to seek additional or different services for the client, to seek admission and management of the client, to seek use of diagnostic and therapeutic tools. Benefits of a referral system. An effective referral system ensures a close relationship between all levels of the health system and helps to ensure people receive the best possible care closest to home. It also assists in making cost-effective use of hospitals and primary healthcare services. Support to health center and outreach services. The experienced staff from the hospital or district health officer helps build capacity and enhance access to better quality care for the patient. They promote diagnosis and management, save time, money, and effort, better outcome, and for the family physician, learning and training purposes, gaining self-confidence, increase communication between the healthcare staff, and for the consultant, improve the quality of the patient management, increase communication between the healthcare staff. These are the referral forms which are used to refer the patient from one hospital to another hospital. In many developing countries, a high proportion of clients seen at outpatient clinic at secondary facilities could be appropriately looked after at primary healthcare centers at lower overall cost to the client. Now it's time for recent advances. This is one of the article which show guidance for investment in primary healthcare and projected resources needs in 67 low-income and middle-income countries. Preliminary findings suggest that low-income and lower middle-income countries would need to at least double current spending on primary healthcare to strengthen their system and universally provide essential primary healthcare services. At country level, primary healthcare intervention need to be explicitly identified and plans should be made for how to most appropriately reorient the health system towards primary healthcare as a key lever towards achieving universal health coverage and health related sustainable development goals. Now it's time for MCQs. In XYZ Theatre performed a street play in one of the rural area near Lahore city on the theme of care of newborn child and how to prevent neonatal tetanus. The element of primary health care covered by this action is health education, provision of basic health facilities, community participation, community treatment.
A.
A. Provision of health education. Teaching women to prepare homemade ORS is an example of equity, equality, intersectoral collaboration, appropriate technology.
D.
G. Appropriate technology is right one. In peri-urban area, a local resident donated room to an NGO to start an immunization center. This is an example of community participation, appropriate technology, intersectoral collaboration, community treatment.
A.
A is the right one, community participation. Fluoride is added to water source of XYZ area after detecting caries in school children of that area. This exercise is called community participation, community treatment, community diagnosis, community work.
B.
B is the right one, community treatment, because they treated the community of school children. Primary health care is a total approach to community development. Which of the following is not an indicator of success in the use of primary health care approach? Accessibility, acceptability, appropriateness, or inequality?
D.
D is the right one, inequality. A 55-year-old male has productive cough for 4 weeks along with low-grade fever and night sweat. The first contact of this person with health system will be primary health care, secondary health care, tertiary health care, or specialized health care.
A.
A is the right one, primary health care. During monsoon season, one of the village near XYZ city reported high outbreak of diarrhea leading to several deaths. A government health team surveyed the village with special emphasis on testing its water sources. The exercise is called community work, community diagnosis, community participation, community treatment.
B.
B, community diagnosis is right option. A tertiary care hospital purchased personal protective equipment to reduce the spread of COVID-19. Due to limited resources, the hospital administration issues these PP only to those workers who are directly involved in managing COVID-19 infected patients. This is an example of equity, equality, injustice, favoritism.
A.
A, equity is the right option. Health inspector from municipal corporation regularly visit the Sunday market to check the quality of fruits and vegetables. Which component of primary health care does this refer? Promotion of food supply and nutrition, maternal and child care, prevention and control of local endemic diseases, appropriate treatment of local disease.
A.
A is the right option, promotion of food supply and nutrition. Objective of health for all do not include to enhance life expectancy and quality of life for all, to improve equity in health between and within countries, to ensure access to primary health care, to ensure access to tertiary health care.
D.
D is the right answer, to ensure access to tertiary health care. This is the key of my MCQs, and thank you.
Thank you very much, Dr. Naila. Very nice, simple, and easy presentation. However, this simplistic issues can make very complex questions. For example, how the health for all failed in previous years, and how the primary healthcare concept, it is something that has led to the universal healthcare. And we know that the targets of universal healthcare, they are still very difficult to achieve in developing countries, including Pakistan. What are the different roles of different organizations in implementing primary healthcare and its integration with the comprehensive healthcare, and how this integration of the comprehensive healthcare can lead to the universal healthcare, and how the poor segments, vulnerable populations, and underprivileged populations can and be given more right or freedom to their essential right of having health, life, and making decisions about their healthcare. These are the few important points. I hope these would be addressed in the coming presentation. Uh, Overall, it is a very nice and simple presentation. I would like that in coming sessions, we would have more deliberations on the complex issues that are associated with the primary healthcare and universal healthcare, and how the targets and the challenges especially has to be dealt with while we are moving towards universal healthcare and sustainable development goals. Thank you very much. See you within a few hours today. Allah Hafiz.
Good afternoon.